Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner. I'm joined today, as always, by my very resolute co-host, Dr. Jason Martin.
I have a lot of resolutions.
You have a lot. It's January 1st of 2024. Dr. Martin, how you doing?
I'm doing pretty good. How you doing?
I'm good. I am super.
Happy New Year.
Happy New Year, right? Like cue the Old Lang Syne.
Yeah.
Yeah, that was so yesterday. That was so last night. So it's January 1st and people are full of resolutions. What is it? It's Monday. It's a good way to start the year on a Monday,
yes,
right?
Yeah.
And also a great way to start the year is to get some listener questions. If anyone is listening to this podcast and would like to watch it, you can find us on YouTube. All of our social media handles are here. We're at Jason Martin, MD, and at Beauty and the Surgeon podcast. You can find us anywhere you listen to podcasts, watch social media, all that good stuff. So, Dr. Martin, something I say often to our patients when we're struggling like with telehealth or something else is that technology is great when it works. And that's why my very first slide is my apologies. I have to apologize to many of you listeners because you have been calling.
Are you serious?
Yeah.
So here's our
Are you serious?
Yes. Here's the number for voicemails. It's 303-630-9038. And I am an Android user. And this phone number is a Google phone number. I got a new phone in August, and for some reason, all of my Google accounts sync to my phone, except for Google Voice. So when I randomly logged on to the OG internet Google Voice a week ago, I found that I had a number of voicemails.
Oh my God.
And a ton of text messages.
This is so suspenseful.
Oh my goodness. So
This is like when you bury something and then open it 40 years, a time capsule.
I was like,
I mean, we should have an episode where we just go back and listen to these for everyone's purposes.
Well, I was completely crestfallen and I was so embarrassed. And so I felt so bad because a number of you reached out to me with specific questions about our supplementation episode. And you've actually already had your surgery that you were asking me questions about. So I sincerely apologize, like so sincerely. But it does mean that it's working, that people do leave me voicemails, and I have fixed my issue. So now it is syncing again.
That's the only part of it I don't like because I liked when you begged. And I'm very sorry to the patients. And this is so apropos for us.
None of these messages were from before September. So, and it's January 1st. So
okay, that's not bad.
It's not bad, but still, that's not how I do things. And I really feel bad. So thank you all so much for leaving your voicemails. And there are a couple that we're not going to answer today because they were specific and that time has passed, but I still will answer all of those. So thank you so much for all of your voicemails, all of your comments. So we are going to go through questions from listeners today.
And I want to apologize to the patients who called in for Amy's mistake. Because I had nothing to do with it.
Yeah. So I am back. Google is back in my favor.
I would never not do that.
Yes.
I don't even know how to log into anything.
Oh,
Amy's the one that logs into all my stuff for me.
Oh my goodness.
That's pretty funny because you're pretty good with technology.
I am. But when you switch from an Android to an Android, like it just,
you're
everything
very good with
goes.
Responding to all the comments and stuff.
All my email connects automatically. Like everything's logged in. Why the Google Voice was the one thing that didn't. And it's the one thing So
that's the way it goes.
Thinking that I had no voicemails, I actually did. And those of you who left them are probably like, this chick is insane. I left her a voicemail and I really appreciate it. So we've got some great voicemails to listen to. We also have some awesome questions that were left on our YouTube channel. So Dr. Martin, let's get into it.
Our favorite episode.
We love these episodes. So this first one was a question from JP, and this was on YouTube. And it was kind of broken into 3 sections. So I'm going to read them and then Dr. Martin will kind of talk about them. Let's just break them in. So part 1 of the question was, if deep sutures are so important, what happens if you have a deep suture push out? Is surgery required to resolve that?
And what surgery are we talking about?
We're talking about Thighplasty.
Okay, Thighplasty, yeah. Mm-hmm. They are very important. We've talked about, you go back and listen to our Thighlift episode, which Nils is going to show right here. It's 2-part. We've had multiple Thighlift episodes.
We have like 4. We have like 4 or 5.
So pick potpourri of Thighlift episodes. Anyways, that deep suture holds the deeper layers, the layers with substance in your soft tissue to the area it's supposed to be. In plastic surgery parlance, it's called superficial fascial system, but for your purposes, it's the deep layer, and those sutures are really important. Every now and then they can actually push through exactly what you're asking. And it's a very good question. In most cases, we'll trim those or take them out completely. And if it pokes through the skin, it's unusual because they're so deep, it's unlikely that they would poke through or push through.
Yeah. And the only time we've ever had to do surgery to resolve that was with an abdominoplasty. It was not with a thigh lift. And this patient had issues repeatedly with the permanent suture, not just the deep suture, but the permanent sutures that we're fixing her muscle wall. Other than that, this is something that can be resolved in the office. Sometimes even just like a little steroid injection to kind of calm down the inflammation. And then we can either just, remove it, sometimes do a little scar revision on that area if it was causing a problem, but it's not a big deal. With the thigh lift, what you're more likely to get is not so much those deep anchoring sutures. It's more like the layered closure sutures.
Yeah, the more superficial sutures will push through and cause irritation. That's very common.
Yeah, and that we just usually trim it. Like that's a nothing thing. Like that you can even a lot of times just do at home. After you've spoken with your doctor, they might just say, "Yep, go ahead and just trim that. Don't pull it." That is one thing I will tell anybody. If you feel like you have a suture that's extruding, people will tell me like, "Well, I pulled on it really hard,
and it hurt.
And it hurt." I'm like, well, yeah,
don't do it.
Yeah, because it's attached. So so don't try and pull it out yourself.
So a lot of these sutures that are deep are permanent, and Amy will tell you that the problem with those is they can get infected, as is evidenced by what she was talking about that previous patient. That's unusual, though. It doesn't happen very often, at least in our hands. I think permanent sutures are necessary in certain areas like a tummy tuck. And for thigh lifts, other surgeons don't use permanent there, but it has to be some suture material that lasts a long time to keep that strength there so your scar, while it's maturing and healing, doesn't pull apart. That's the whole idea, so things don't spread.
Yeah, and maintain repair. So the second part of JP's question was, how do you avoid infection with medial thigh lifts when they are so close to bacteria from bodily functions?
Oh, very good question.
We do talk about this on our episodes. This is why on all of our thigh lift episodes, there's the special considerations, because there are special considerations when you have an incision that is in
Amy is the body hygiene expert.
Yes.
Okay.
That is in a dark,
if you have any
moist
body,
area.
If you have any body hygiene questions, it doesn't even matter if it's about surgery. She will answer them
I'll
for
answer
you.
them. Yeah.
And smartly too.
Yeah. The key is, and we actually did have a patient years ago who'd had a medial thigh lift in another country and came back with an area of the incision that had opened up, which is not completely unheard of. And I think we may have mentioned this in one of our thigh lift episodes. And unfortunately, I mean, this patient did need to pretty much shower anytime they would use the restroom, because there was just no avoiding getting some bodily fluids on that area. And to prevent infection, I mean, if you've got a sitz bath or if you had a bidet, that would be ideal. In this country, we don't have bidets in most of our homes, unfortunately. So yeah, there could be times when that is the recommendation. However, with your incisions, as long as they're closed, just normal hygiene is going to be appropriate.
Yeah.
Showering normally.
Exactly. Yeah. So even though they're near things that can cause contamination, they aren't in those things. So around your buttocks area or around the genitals, whatever, you can obviously have contamination in these areas, but it's pretty unlikely if you're very careful when you go to the bathroom, and also with like showering and hygiene and stuff like that. And so in our experience with our patient subset, it's not usually a problem, surprisingly. Now, we have very healthy patients. I get that that may not always be the case. You may have some other medical problems, but in those situations, should you be doing these surgeries to begin with?
Yeah.
The reality of our bodies, if you just think about it anatomically, is that there's bacteria all over our bodies. So it's not bad that things touch it or even can get on the incision line. It's that you don't want certain types of bacteria there.
Yeah.
And just normal bathing and normal hygiene will ensure that you won't have that problem.
Yeah.
The other cause of infection after surgery, and Amy and I are fortunate to work at really clean and good places, is bacteria that's from the operation itself in the OR settings. And there's pretty rigorous protocols for these OR facilities to follow. So that's even unusual too.
Yeah.
I don't remember the last time we've had a situation like that.
Community acquired infection.
Yeah. And hospital acquired too. So,
yeah.
Okay.
Yeah. So great question, but just normal hygiene, people tend to overcomplicate things. They think they need to, I mean, I've had a patient who, like a week after surgery, when do I stop using the HIPAA cleanse? I'm like, oh my gosh, your poor skin, like stop using the HIPAA cleanse. Like, our normal hygiene is enough. I mean, bacteria is all over us. It's just keeping it normal bacteria.
What is normal, Abby?
It's Abby normal for you. Yeah. And then the third
is Nils normal?
Yes.
No, he's not.
Not everyone says that.
So the third, and this was probably my favorite part of this question, JP, was that I'm going to read it kind of in reverse. So not concerned from a fitness perspective about this question, but had originally planned on starting training about 8 weeks after surgery for an Iron or a sprint triathlon. So if you're still in acute recovery for 12 weeks.
I love the fact she breaks down a sprint triathlon, which is swimming, to 20 kilometers of biking and 5 kms of running.
Right, which is totally different than like an Olympic distance triathlon or even
I wonder how long that
Ironman.
takes.
Yeah. This is a sprint triathlon is the lowest kind of starter version of a
Right, but like what is that? Like
couple
a
hours.
couple hours? Okay.
Yeah, a couple hours. I mean, a 5K run. I mean, if you're really fast, you do that in 15 minutes.
Oh, Amy, I do
same
that
thing.
in like 12 minutes.
Same thing with a 20-kilometer bike ride. So either way, this is an amazing goal. So you were wondering if it's okay to start, reasonable plan to do it 6 months after surgery, after a thigh lift. I would say probably. You know, if this is the activity level that you are at and you are close to this type of conditioning prior to surgery, taking the time off, the swim. I know that Dr. this is why
I hate my life.
Loves talking to me about swimming. You know, as long as everything heals well, I mean, and you know that you
It's
will
like Groundhog
be,
Day. It comes up over and over.
Yeah. These are all things, right? Swim, bike, run that require you to be flexing. Your leg movement is key for all of these. So
Especially the muscles that Amy loves.
gracilis,
Yeah,
sartorius.
sartorius, yeah.
Those adductors. So yes, I would say for most people, if they are already in this condition, yes. Now, if you are like, this is a life goal of mine, I've never done it before, and I also need to lose 30 pounds to be ready for it, or I've never ridden a bike, then no, that is not realistic. I would give it a year. What do you think?
Yeah, I agree. I mean, she said considering starting 8 weeks after surgery. I mean, that's what she said in her comment.
Which may or may not be realistic.
It's probably not going to
Probably
happen.
closer to 12.
Yeah. And I think from there, and then, yeah, as Amy was talking about, I mean, with any performance, athletic performance, it just depends on your conditioning. So it you know, you definitely would be able to do that by 6 months if you were in decent condition. And it just depends on where you're starting from.
Yeah.
So, but it's a good question.
It's a great question.
And the reason why it's a good question is that thigh lifts, as we've said many times before, are one of the most limiting surgeries to recover from.
Especially for things like biking.
Right. And so since we live in a very active state where people do a lot of activities like sprint triathlons, then you have to expect this is going to be a big change to your lifestyle. And you have to prepare for that mentally and physically. So it's the mental part that's hard sometimes for people. But you can be really creative. We have patients that are super creative in terms of their fitness afterwards.
Yeah.
You got upper extremity stuff that you can do.
Yeah. And you know, even things like recumbent bike, you know, something that wasn't putting as much like direct pressure on those incisional areas. There are things that you can probably start doing at 8 weeks. Just getting back like in the drops on your bike at 6 weeks is at 8 weeks is not realistic. And same thing with potentially running. I mean, and swimming, all of them, right? All these things.
Yeah.
All the swim, bike, run.
Yeah.
I'll pose a different type of challenge. You know, I think that's a really good conversation to have with your operating surgeon as well. And for you mentally knowing that as an athlete, if you do this surgery and it means you do not reach your goal of doing this, how is that going to impact you mentally? If you're like, no, I have to do this in 6 months, that's also something for yourself to think about mentally.
And talk to your surgeon about for sure.
Yeah. Because if it's going to devastate you to miss out on this triathlon, then, you know, that's not a great place to be in either.
So the real question is, JP, her name, or is that like her initials?
Could be what she goes by.
Yeah, exactly.
JP?
And then what does JP stand for? That's I always wonder that.
Usually John Paul,
Yeah, but yeah.
I don't know.
Yeah. Anyways,
Yeah. So great question. Thank you so much. And good luck on your triathlon. That's
good luck.
awesome.
Good luck.
Yes.
All right.
All right. So now.
We should start sponsoring our patients for, you know, these kind of put our logos on their swimsuits.
Yes. So this next one, this is a voicemail, and this voicemail is from Michelle, who is a well-known person in this podcast realm. She has left message or sent messages to us before, and I love this voicemail, something we talk about a lot, and I'm going to go ahead and play the voicemail.
Hey, Amy, this is Michelle from California, and I just listened to your podcast with Dr. Martin on facelifts. So I'd actually come out during the pandemic to have a Mommy Makeover with you two, and the hospital shut down. So I still need to have that Mommy Makeover, and but 4 years later, 3 years later, I also need a facelift. So here's my question. What should I prioritize as far as the order of those two surgeries? Will one heal faster than the other or impact the other in some way? Which one would you guys recommend that somebody does first? Thank you.
Michelle, I love this question. So to summarize it is, she wants a mommy makeover, kind of planned for a mommy makeover about 4 years ago, but now realizes that, 4 years later also needs a facelift. And let's just say, for sake of answering this question, she's not doing them together, because that would be the easy solution. Just do them all at the same time.
Which is what we do.
Right. We talked about that on our mommy makeover episode, that a mommy makeover can include a facelift.
Yeah.
And does for a lot of women. But for sake of answering this question to Michelle, what do you think, Dr. Martin? Late 40s, needs a facelift, also needs a tummy tuck. What would you say?
I think tummy tuck probably. The facelift is going to be inevitable. Tummy tuck she's lived with, post pregnancy, post having a baby. So that's probably the way I would go. But the bang for your buck is going to be the facelift for sure, always and every single time. So it really does depend on the person's kind of perception, And it's weird because you go over this threshold area that we talk to the patients all the time about, where they're in their low 40s. Tummy tuck's better, but as they get a little bit older and you start to see the facial aging, you just see that switch go into the facelift part. So if I had to pick what's going to have the most effect for her on just the way she looks, is probably going to be the facelift. If I would pick based on what most people want, if you've lived with a lot of extra skin and soft tissue after pregnancy for a long time, you're probably going to want that first. And that's what I see with patients that come in. Sorry, that's an invasive answer. Does that feel like I was sitting in front of Congress?
No,
there?
I think that's absolutely the answer I would give. Now, if someone said, I only have X amount of money, I can do one or the other, and this is it, I would always go with the facial procedure, because that's the thing.
In that age group.
Yep.
If you're 35, 40, and you're talking about a teeny little mini facelift versus a full tummy tuck, obviously.
Yeah, that's different.
You're really kind of prioritizing what's going to have the biggest change for you and transformation.
Yeah. And the thing with the abdomen, you've lived with it for a long time. So there's that thought well, then you should take care of that first. At the same time, though, you've lived with it for a long time and it's not really going to change. And it probably hasn't changed. You can be 45 and get a tummy tuck, and at 55, that tummy tuck is identical. Whereas waiting past dealing with facial aging for another 10 years is a little different. You're looking at it every single day. It is progressively getting worse.
Yeah.
So
when we talk about facial aesthetics, we think about it in terms of retirement. Retirement, you're always contributing to your 401k over time. It's a long-term process, right? Everyone understands that mindset. And that's basically facial aesthetics. And, for retirement or for savings, it's always better to start earlier. And that's true with facial aesthetics. The dividend, it pays off more over time. And whereas doing a tummy tuck is like a renovation of your house, you probably just do it one time and you can live in that house for a long time.
And you might be the only one who appreciates the difference.
Right. The other part is clothing.
Yeah.
And it covers things up. And, we've had patients that come in that have real bad problems with their bellies. We get that. But most patients, it's not bad. You wear clothing, you really wouldn't know the difference. This is the way they feel when they sit. It's where they wear a two-piece bathing suit, certain types of things that show their... Are we allowed to say midriff? Is that an old word? Is it?
Yeah. What other word would you use?
I don't know. I don't know what the kids are using.
Midriff. I mean, that's why it's called a I
don't know.
Crop top.
Every time I say a word, I look over at you. And it's like, is that a cool word?
Midriff
or not
is
a
a normal word.
It's a normal word. So, that's kind of the way. But it really, I think facial aesthetics also in a weird way gets a bad rap, because, most moms are like, I get a tummy tuck, but I would never do a facelift. And I think some of that is what we see in the media. We've talked about this in social media.
Listen to our episodes about myths.
And the dark side of plastic surgery. He's going to show you that right here. That's actually an amazing episode. It's one of my favorite episodes of last year.
Well, every single myth episode is the myth that no one else does this. I don't deserve this. Those things we all tell ourselves, like the stories that moms especially tell themselves about their bodies.
It's not worth it. I'm not worth it.
Yeah. Or I should just be able to fix this, or I don't, all those things, or everyone will know, or
Pilates is going to fix the extra skin and soft tissue on my belly.
Those things.
Yeah.
But something else she asked was will one affect the other? No. So you could do them in either order and it's not going to matter. I will say this, what might actually be a positive is if you did the facelift with all the lipo you wanted and get that all out of the way, and then you come back and just do the tummy tuck. That ultimately, if I could choose how a person did it, that's what I would recommend. The thing that's going to be
like a surgery hack.
Yeah. The face and neck lift is super, the recovery, if you watched all of our episodes about that, recovery and downtime is not bad. Recovery from a tummy tuck is a little more involved. Recovery from lipo hurts. So if you could choose any combination of these, I would do the facelift with as much lipo as you want, get all that done, and then just come back for the tummy tuck, because that is going to have some, physical downtime. that would be a great way to not like to break it up.
Yeah. And people are surprised to hear that too, because tummy tucks, you may have to take an extended time off work depending on how aggressive the surgery is. Whereas face and neck lifts, you could be back doing in front of people work duties within a couple days.
Same thing with the lipo. Like it's just going to be sore.
Right.
And it's not going to stop your recovery.
It's not. Yeah, you can actually function normally. Yeah. So, last thing I'll say, and I wasn't allowed to say this because I was given bookends by Amy, which is inappropriate. But we almost always do these together, and that's not unusual. So for most of the women that come in, we'll not only do the tummy tuck part and something for the breast, we'll do something else. And that could be a mini facelift, or that could be liposuction of the arms, or whatever. Watch our Mommy Makeover episodes. And so I don't think that you need to silo these if you're capable of doing them all together financially, with support from family for recovery, and then, job or responsibilities. So.
Oh yeah. If you can safely combine surgeries, we always say do as much as you can at once.
Yeah. And then obviously, most importantly, your medical history, if you're a candidate for this procedure, medically speaking.
Yeah. So thank you, Michelle.
Yay.
Yes. Love the voicemail.
Thank you, Michelle.
All right.
Sorry about the shutdown of the hospital.
Oh gosh, that sucked. Yeah. All right. So
that was a weird time.
It was. And I was actually.
Doesn't seem like a bad dream.
I was in an airport when I got the call from the OR. So like then I'm calling a patient. I was at the airport flying into Denver also. So was she. She'd literally just gotten off the plane. Like it was a nightmare. So okay. We're going back to YouTube for this one. This is Monica from Canada. I had to throw in the from Canada because I cut out that part of the question, but she talks about being from like a very isolated area in Canada, which I am like, thank you, Monica. I love that you found us. I feel like everyone who has found us from Canada has been in kind of a remote location, which fair. Like there's not probably a lot to do there. Podcast is what you want to listen to.
Yeah.
When you're hiking, when you're out doing
cool
stuff.
I think what you're trying to say, because that came off a little offensive toward Canadians, that there's a lot of remote areas in Canada. Right? Is that what you were saying?
I grew up in a very remote part of
I
Colorado.
know. That's why
no shade.
I'm clarifying what you're saying. You're not implying that all of Canada is remote, because Toronto and...
No, I'm just saying she said she was from a remote
I got it.
in Canada.
And we have a lot of people that listen from remote areas, but Canada has a lot of remote areas. I mean, it's some of the most beautiful country in the world.
Yeah.
Yeah.
No, this was no shade to Canada.
Okay, good.
Or for the remoteness. I think that's awesome. I grew up in a very remote part of this state. So, all right. Monica from Canada asks, she's just shy of 70 and researching deep plane facelifts. How do you identify nerves under the SMAS? Do you use a stimulator to identify them?
You actually can, but you can actually see them too. The nerves.
They're pretty big.
Yeah. In the area, I mean, they're small, but big. They're visible. So when in the area that you're elevating that SMAS, or you're going underneath the SMAS, you can actually, that area, the nerves are
it's crazy.
Big enough to see. Now they get smaller and smaller as they go more toward the center of your face. And actually,
all those little dendrites.
Right. And the demarcation zone is usually around the midline of your eye, your eyeball itself. If you go down the midline and you go inward towards your nose, towards your mouth, that's where the nerves get really, really thin, and they start to get a lot more superficial. So any kind of work that you do, you want to stay, and this is what I tell the fellows, you want to stay away from the midline of the eye and out towards your hair and ear, etc. So... But they're visible. But there are nerve stimulators you can use. You can actually stimulate those in the area that it innervates. It will make either the mouth move or the cheeks move or your brow move, depending on what nerve you're looking at. Yeah. I think it's interesting. If you could please go back and listen to our Facelift Myths episode. We do have, and Nils will show that here. We do have one question, I believe it was from that episode. They're all running together, where we talk about deep plane facelifts.
It was on the myths that a deep plane facelift was somehow superior.
And it's not always. And usually actually...
Specifically for this age range.
Yeah, and for someone who's 70, you may just need a standard facelift. So you may think, hey, I need a deep plane facelift. That's what's new and in vogue. It's going to have a quicker recovery. But you may have, associated with your deep foundational problems that the SMAS lift addresses, you may also have a skin problem, and that's common. It's definitely in your 70s. So I think you should see a board certified, and we talked about the American
Royal Canadian Board of Medicine,
College of Medicine.
Royal Canadian College of Medicine. Yeah. Yep.
You should definitely see someone certified, and they're very well trained. They come to all of our meetings, the plastic surgeons up there. See someone up there who has and I know you're in a remote area, but see if they do telehealth. Talk to someone in that area, or do a telehealth appointment with us. We can even talk to you too.
Yeah. So thank you, Monica, for the question. That was a fun one.
And
Yep.
Yeah, very
That's a good
smart.
one.
I hope she lives near Banff because I want to go there.
Beautiful.
Oh,
Yeah.
Banff is gorgeous. And that is remote and amazing. Remote to me is a positive. Like, I love that you think that I was throwing shade with remote.
Well, it came
like
off a little bit acerbic.
No, remote in my mind is a good thing.
Like she rides a moose to work.
Yeah.
I mean, goals. Like, I dislike city living.
I
so-
love remote.
Yeah,
Yeah.
I am not a city
And I
person.
just imagine, Monica sitting out on a mountain lake.
Listen to
you know,
podcasts. Like,
listening
that's what I
to a
mean.
pod-
Like,
I mean,
I
come on.
love it. Yes. I mean, it just
She's
shows.
very lucky.
Yes. So, yes, no
Except
shade.
she can't go to Costco. It's probably not close.
Do they have Costco in Canada? I know that Target failed in
I
Canada.
feel like they have Costco in every country.
I don't think so.
Okay.
No, that's not true.
That's definitely a Google question.
Yeah. All right. Well, let's take a quick break and we'll be right back.
Be right back.
And we're back. And we're back with a voicemail. Yes.
I love it. So are these all from the ones that you lost?
These voicemails are all for the ones from September
That's
forward
so
from
crazy.
the change. Yep.
Yeah.
These are all new ones. Okay. So this is Amy from Detroit, Michigan.
Hey, Amy. This is Amy from Detroit, Michigan. I have a question regarding getting face and neck lift surgery versus getting a body lift and breasts. I am a bariatric patient. I started with a low BMI, so I'm pretty sure 6 months out I'm going to be close to being done losing weight, 9 or 12 months away. I would love to get both, but I don't think it's recommended to get both done in the summer. I have summers off. So I'm just wondering, how do I decide which to do? I've needed the neck lift since before surgery, and I need fat transfer to the face, although I probably am going to have not a lot of fat left to take from, and I also want to put some in my breast. So I'm just confused as to which surgery I should be getting consultation for to do next summer. My bariatric surgery was at the end of March 2023. Thank you. Bye.
So first off, Amy, congratulations on reaching your goal within a year of surgery. That's awesome.
I love it.
And you're very smart with your timing. We have said before, we recommend a year out from surgery before you start considering, skin removal surgery, just to give your body a chance to kind of reach that homeostatic level of body fat and let your skin have a chance to kind of rebound a little.
And it actually depends on the type of surgery you have, because in the old days, at least with the Roux-en-Y's, and I'm not sure what you had, you have to wait up to 2 years actually to get to that plateau level. So it depends on what your bariatric surgeon told you about when you should and expect to reach your plateau. And that's the most important part. When do you stabilize?
Yeah. And that's why, in this situation, and I love that this was such a similar question to our previous one about timing of procedures, but in a very different context. You said you needed a face and neck lift prior to your bariatric surgery. And that's, in this situation, if you can't do them all together for whatever reason, again, like we said in answering the last question, if you can do as much surgery as together as possible, awesome. However, let's, for the sake of argument, say you're only going to do one, and it is summer. I would tend to go with the face and neck lift first, only because it's less likely to be impacted by additional weight loss within reason.
Mm-hmm.
And
that's a good point, Amy.
Less likely to have additional skin contraction.
Right.
So giving your body as much time to bounce back from the weight loss as possible would be my recommendation. But if you needed the facelift before surgery, that's never going to change. It's going to
It's going to get worse. The more fat you lose, the more your BMI goes down, the more your face looks aged. And that's the problem with weight loss in middle age. We see it all the time in our clinics. People come in and they're like, oh, I lost all this weight. I feel better, but my face looks like not the way I want it. And that's from that loss of volume in the face. Secondly, just fat transfer itself to the breast. We have a great episode on that, which is non-breast augmentation without fat breast implants.
Yep.
It's like 3 years ago. That was actually a really good episode. And we talk about the fat transfer to the breast in that situation is really, you're not going to get as much volume as you think. So that's only for aesthetic small improvements with either.
But great with a lift.
Yeah.
Yeah.
With a lift, or if you also put an implant in, you can make the décolletage or the cleavage area look a little bit better. In terms of how you break these things apart, again, this becomes a really personal decision. We always tell the patients to take the emotional part out of it and be really pragmatic. Look at it as like a chess match. Okay, I have all these things I need to do. How can I get to the end result as quickly as possible, as efficiently as possible with my life constraints? And that really just depends on your job, support,
Finances.
money. Yeah, money is a big part of it. This is a lot of expensive surgery, recovery. At least you have the summers, you said, which is awesome that you can recover in those. And there's nothing wrong with breaking things apart. Amy and I support that, especially with the
body lift.
Yeah,
that's
with the
a
body
lot
lift.
of surgery.
So my feeling is exactly what Amy said. I would actually do something different than you're going to think. I would do the facelift and neck lift, and I would also do your breast. Consider that, and then save the body lift, because that's going to be the biggest recovery. So get all the other stuff out of the way and just do and isolate that body lift.
Having full use of your arms for the body lift will be key.
Mm-hmm. Yep. It's really hard to do the breast, especially if there's an augmentation, actual an implant. And you may just get a lift, so that's a totally different story. But if you have an implant and do a body lift, it's very difficult to recover from that, because you're limited on arm usage. You can't lift yourself off the bed, and then you're really stuck with having help around the house, which is fine for the first 3 days. But after a week of that,
3 weeks,
people start going crazy.
Yeah.
So I think that trying to get everything out of the way, not related to the body lift, or do the body lift first and then do the other stuff second. I think that's the way to go.
Yeah. And I'm with you, though, because she wants to do fat transfer to the face and potentially to the breasts. That's why I 100% agree that doing the breasts and the face together with as much fat transfer as you can get, because again, if you do continue potentially to lose a little bit more weight, that fat is going to go down. So if you wanted a touch up of your fat transfer, which is
very common,
or more fat,
yep.
If you take it all away with the body lift,
60% of the fat makes it. Best case scenario. And then you've also had bariatric surgery, so hormonally speaking, I'm not sure that how well
too.
Yeah, and the nutrients and how well, just your nutritional status, depending on the type of surgery you had, then fat transfer is not going to work as well for you. So you should, in your mind, think you're probably going to have at least 2 fat transfers. Get that done on the first case, come back for the second case, do fat transfer again.
Touch it up.
Very smart.
Top off fat transfer, top it off. But either way, I mean, just a little more.
It's like the old school gas stations where you go in.
Top it off. Top her off.
Top it off, sir.
Yep, top it off. So there's no wrong answer, but it's the answer because it's the answer that works for you. But I think that this makes the most sense given your history and where you're kind of at. So thank you so much, Amy. I really appreciate the voicemail, and good luck. You live in a great part of the country where there's a lot of good doctors, so find a nice...
Oh, Detroit's great. Chicago, where I trained.
Board certified plastic surgeon. You're going to do awesome.
Board certified.
You're going to do awesome.
Yeah.
All right, so we're back to YouTube. And this one was from Mahogany Tresses, which I love because I'm just like, ooh, yep. It makes me just think of like gorgeous, mahogany red hair. So another one who has lost a lot of weight. I've lost around 70 pounds. Did not have bypass. I cut that part out. Maintained goal weight for 4 months now. I have a few Facebook Thighplasty groups, which we love. And some female patients have reported labia discomfort from the pulling.
Yeah.
Will being less aggressive with pulling the inner thigh area decrease the risk of labia pulling? And one thing that we don't know, just to kind of throw this out there before we start answering this question, is at what point in recovery are these women reporting this? Because if they're reporting it within a week of surgery, like yes, even just inflammation can cause that feeling of pulling. However, if they're reporting it a year after surgery, that's a little different.
Right.
So
even a couple months after surgery, you can still have a little bit of, you definitely have a feeling of tension there.
Yeah, because there is. I mean, there is tension.
So that's a really good question. And absolutely, if you pull less, you're going to have less pulling on the labia, but then you have less results. Or maybe, yeah.
Because it's the scar placement
that
really
makes the
difference.
It's the scar placement, it's the technique. But in general, if you're thinking about it, and plastic surgery is not complicated if you take a macro view. Obviously, if you pull less up, you're going to have less pull down, which is what that labia is doing. But then you're spending all this money and have this recovery time, and your results are average. And that's not what we, at least in our office, do. So there's always that balance of how much you pull versus what is, doable. And you're always coming up against the maximum. That's what I do for a living. And that's why you have to go to someone with experience, someone who does these surgeries and feels comfortable and facile with the procedure itself. And that is sometimes hard for patients to understand. We have a great Thighplasty video that shows, and I'm sure you watched this, and that's probably where this came from, but it shows, we talk about that. We talk that not everyone does these types of surgeries, especially thigh lifts. So you want to make sure you go to an office that definitely they feel comfortable. And you can tell that when you go in. Yeah, let me look at your picture. Oh, you do this? Yeah, okay, yeah. What's your approach? That kind of stuff. And I think you can kind of figure that out pretty quickly.
Yeah. And the one thing I did respond when I responded to this question on YouTube was really focusing so much on that scar placement. And that's where somebody who does these a lot will be able to tell you exactly where that scar is going to be, because you could barely pull it all. But if where you place your incision is actually excising part of the labia and attaching it to the thigh, essentially, that's always going to feel like it's pulling, even if there's no tension on it, because you've changed the anatomy in a way that is odd.
And the further you go away from the labia, the more visible it will be in normal underwear.
Right. So everybody wants to sneak it in, but that's also not great either.
Our job is not easy.
Yeah. You know, so
like it's so funny. I simplify everything. And then when you do these things, you're like, wow, like I really it's just like you're walking a tightrope all the time. Mm-hmm. The most change you can make versus keeping and scoping in any kind of complications that could occur and like minimizing the risk. Yeah. And it's always the same every single time.
Yeah. And thigh lift incisions, like we say on our thigh lift episode, they heal remarkably well. You know, given as we had that, you know, one of the questions toward the beginning of the episode about like bacteria and other issues in this area, like, yeah, this is an area where you'd think like, wow, this scar is going to be challenging. It is while it's healing, but once it is healed, it heals so well. And I think that is where doctors probably get into a place where they're trying to sneak it in too far because they are worried about people seeing it. But ultimately, if you place it directly in the crease, once it's healed, you're not going to see it. And if someone does see it, it's because you've either are okay with allowing them this area of your body, you know, or because they saw it because it was showing in something you were doing. And either way, is it any of their business?
This is Amy's go-to.
Yep, this is because it people fixate so much on the scar.
We need to have a PSA of Amy that you could just play on your phone if someone sees it. You're like, hold on for a second, watch this video, you son of a bitch.
This scar is none of your business. Like, like it is none of your business.
Like a GIF.
Right. I could be. Yes, I do need a GIF of me saying none of your business. This scar is my business. So, I think that's where you're going to someone who really understands that placement needs to be where it needs to be for this particular reason. Once everything's healed, that really, we have not had that be a lingering issue. We did have a patient who I may have brought up one time on one of our thigh lift episodes who did say that it felt somewhat like you were wearing like really tight bicycle shorts and like part of your labia was perhaps pulled aside, and that was a feeling, but that did go away.
Yeah,
it took several months.
Right. And by the way, on her exam, she did not have pulling of her labia.
No, it was not.
Her labia was in its normal anatomic position.
But the mental is there.
Felt tight in that area.
Or it felt pulley.
And she even said, she goes, I know it's not because I see it, but it has this feeling. And I told her, I said, that's healing. Mm-hmm. And that tightness is actually necessary. I really resuspend that inner thigh to give everyone every inch more I can with the surgery. So
yeah,
but it's good. Like if the procedure is done correctly, if the incision is placed correctly, if the suturing that's deep is done correctly, this is like a Thighplasty episode for all these questions.
Were a lot.
Yeah.
Yep.
And then also the recovery is dealt with appropriately, which is a big part of it. Going to an office that can help you recover. You should not expect that your labia will pull, period, end of story. So we don't have that problem in our practice. We try really hard to avoid that and also maintain, visible results. So.
Yeah. And you brought up such a great point in that sometimes your perception of something is not the reality of what it actually is presenting as. Like if your labia is truly effaced, like if it actually is spread versus just the feeling. People will oftentimes ask me after a face and neck lift, like, when will the tightness go away? I'm like, well, I wish I could say never,
Mm-hmm.
Really do. I wish I could say never because it will, but those feelings that we have of things being tight are not, that's not always the reality of
So
of
when it gets cold in Colorado, I'll sometimes sleep with a sweatshirt, and it makes me feel good. I can wear that sweatshirt all day and contort my body and it never bothers me. But once I get into bed,
I hate that feeling.
That feeling of like being constricted or touched.
I don't understand how you do the weighted blanket.
Oh, I feel like a baby in a mom's womb with that weighted blanket. I don't ever want to leave.
Like I'm a burrito that's also been swaddled.
Oh yeah.
Oh my goodness. Well, Mahogany,
if I could have a compressive blanket that just sucks me in, that I cannot move, I would be okay with that.
That gives me anxiety even just thinking about that. Oh my gosh. So yeah. Well, Mahogany Tresses, thank you so much, and send your Facebook ladies our way.
Yeah, we like the Facebook ladies.
Yep, we got real talk here. All right, one more voicemail. This one's from Mary, and Mary's question is talking about facelifts, fat transfer. This has been a theme. We got lots of face and a lot of fat transfer. Love these questions. All right, here we go.
Hello, Amy. My name is Mary. I have a question on fat transfers with a facelift, a neck lift, if you will, facelift, neck lift, a combination that someone would have. Tell me about the fat transfers. Does it work? Does it last? Does your body metabolize it and it goes away after a while? What's the feedback on that? Thank you.
Awesome question, Mary.
I like how she was very specific.
Yes.
And she went through that real quick.
Yeah.
She definitely is.
This is why voicemails are amazing.
She runs something. She has a leadership position.
Yes, this why.
Like Mary was not fooling around, and it didn't seem like she was reading. Like she went down that list.
She had it.
Yeah.
Yes. So we do have a great episode about how to age like a Hollywood superstar, where we talk about fat transfer of the face. We do talk kind of about how it works. Does it last? Will your body metabolize it? Now, this is true of fat transfer anywhere. Does it work? Yes.
Absolutely. So fat likes blood supply, and the most vascular part of your body is primarily the face, or the head in general. So that's number one. If you're taking fat from one area and putting it in another, the face is the best place to put it. It's the most likely to survive. Secondly, it does absolutely work, and it's been used for a long time. When I went through training a long time ago, they were doing fat transfer back then. It's only gotten better.
Way better. Yeah.
The process of purifying the fat before you inject it, how we harvest it out. Some of the technologies we use something called LipoLife or BeautyFill. I use things in the OR, Pure Graft.
Vaser.
You can use Vaser, VASER. I mean, there's so many different things we use for fat grafting. We're definitely an office that has expertise in that, and it definitely works, and it definitely lasts. Once it takes, it should last indefinitely, depending if your weight is maintained. It can definitely metabolize. We've said this many times before. 60% of it will make it, best case scenario, and that's someone who's young, who has no issues, and it's a perfect case scenario. Every decade of life, that percentage goes down. So, if you're doing a facelift, you're probably middle-aged at least, so you assume that you're not going to have 60% take in most cases. And but just like fat in other areas, it won't go away. It will fluctuate with your weight once it takes. So
yeah,
it's a very reliable procedure for the face. It answers a lot of the problems of facial aging, which is not just loose skin, which is not just descent or things drooping. It's loss of volume. And loss of volume, and you can look at me, like the way if you look at old pictures of me, we should look on, the website has newer old pictures. I can't remember.
They're a couple of years old, but they're when you were at a really nice, like healthy place.
Yeah, so if you look at older pictures, it had this round face.
Yeah, they're not those pictures.
And now it's more like skeletonized or angular, and it doesn't look that bad on a man maybe, but it's rather, you can see the change, the loss of volume in my face. Amy tells me about it every week, so not very nice. But adding volume back to the face is great. You can use fillers for that. Fillers, you have to go back and do injections over and over. It can become expensive. And secondly,
it can also be somewhat distorting,
and they look unnatural, where fat is usually done deeper and just kind of a nice augmentation of the face that has more of a natural appearance.
More of a rejuvenation versus a fill.
Yeah. And then the secondary benefit of fat, usually the fat transfer can have quote unquote stem cells in it, which we can't really talk about, but they're there. And that is a benefit too. So there's a really holistic, wonderful part of fat, I think, for facial rejuvenation done conservatively. Over injection of fat is not great. So it has to be, you have to go to someone.
Because it does last.
Yeah, it does last. And it's hard to remove that fat once it's in. We get that question a lot from the providers or the surgeons we train. I've had that question multiple times from surgeons who do fat injections, and they have too much fat in there and they don't know how to get it out. So I have to kind of give them advice how to remove it.
Whereas with filler, you just wait for it to go away and or you can dissolve it. So with fat, it is a little bit different. But with a fat transfer and a face and neck lift at the same time, your chances of having a really nice result are way higher than if you were to just do fat transfer and try and pretend like it was going to give you a facelift. Yeah. As some doctors will try and sell you on. So the more volume, the more likely you are to need, touch-ups and revisions of your fat transfer and or like alterations essentially to kind of make it match side to side. I mean, when we're talking large volume, like things like, fat transfer of the glutes or the breasts, like those things are large volume fat transfer. Like it's more likely that you'll, maybe need more in an area. Whereas with the face.
Yeah, that's a good point, actually. Very good point.
Yeah. It's rare that we need to go back in and touch up.
You're absolutely right on that. It's actually, you're so smart.
It's like I've been doing this.
Yeah, it's like I've been doing this for
we do this for
100 years.
Yes.
You're the white Gandalf, of plastic surgery management. So the facial stuff, since you're doing it conservatively anyways, really, we don't usually go back and do secondaries, but it happens every now and then. And then FYI, if you need a facelift, you need a facelift, period. And if you need volume, period. So, and facelifts can help a little bit with volume, but they won't solve the volume problem. So, it's really what you need more than like, should you do this or not? If you need volume and you need a facelift, then a fat with a facelift is the best option, period, every single time.
Yeah. Yeah. So there, Mary, thank you so much. Love this question. Make sure you click on the link below to find a board certified plastic surgeon near you who can do these procedures safely and give you a beautiful result. All right. So those were the questions. And again, huge apologies to those of you who were waiting for responses from me since September. Especially, there were so many awesome questions about supplements. I had no idea. So I appreciate those so much. And I 2024,
I had nothing to do with it.
No, Dr. Brian had literally nothing to do with it. Neither did Nils or Sarah. Like, this was all
I'm a child.
on me.
I have no responsibility.
This was 100% on me. So
yeah.
My 2024 resolution to all of you listeners is to not let this happen again. So it will not. Okay. So because we usually do our first episode of the year, because it's January 1st, talking about something that's like esoteric, like how you feel about yourself,
right.
or does plastic surgery make you happy? I had to throw in something that was like that kind of thing. So if you've made it this far in the podcast, we're going to do a 2024 Would You Rather. I actually heard this question on another podcast I listened to. It's called Say More, and it is Phoebe Hagen and Laura Lee Chapados, who are both IFBB Pro bikini competitors. So they were doing this whole Would You Rather episode, and this question came up, and like, it literally has stuck with me for weeks since I listened to this episode, because it, like, I felt it in my soul.
So when I was younger, as a young man, the Would You Rather ones were always terrible choices.
Right.
They're like, would you rather break your leg,
Right, or be thrown in
chop
front of a
off
bus?
your small finger?
Yes.
So is it one of these kind of questions?
No,
Okay,
this
thank
one
God.
will literally, like, for me at least, like, it like wrecked my brain. So
Okay.
I'm going to ask both you and Nils. I asked Catherine, my assistant, this yesterday to kind of see what her response was, and I told her mine, and it was just different. You know, she's more than a decade younger than all of us, so it was interesting to see her take as someone who is at a very different point in their life than my take.
Right.
So the Would You Rather spend 1 minute with yourself 10 years ago or yourself 10 years from now? You have 1 minute with yourself.
Go ahead, Nils, you first.
Oh, sure, put Nils on the spot.
I actually got a mic here.
Mike.
All right. I would have, say, 10 years in the future, because not a whole bunch has changed for me in the last
You're so
10
boring,
years.
man.
I know I'm boring, because, you know, Sarah and I have been together 26
Yeah.
years.
I feel like we've been doing this podcast
You
for
know,
10 years.
Yeah, it's
9.
almost
9
like
years.
we're getting up there. But like, I was in a corporate job but I still
Yeah.
did what I do. So it would be cool to tell him, like, hey, you're going out on your own, and it's going to be the next whole cool thing about your career. However, 10 years from now, I can kind of see where I am health-wise. I can kind of see
Yeah.
where I am relationship-wise with, you know, everyone in my life, because through your 40s, you know, like,
Totally.
you know, you
Yeah.
kind of like phase away from different people and everything, especially over COVID. So yeah, I would say 10 years from now, it'd be interesting to check in on older Nils.
Yeah,
I'll take
so
that.
it's a pretty like straightforward answer, because you would only go 10 years back to make money. So you would go back and say, you know, buy Tesla stock, buy Bitcoin, and sell it at this
That's
number.
so funny. That did not occur to me at all.
100%.
Oh yeah, I didn't really.
You would go back in time. You would bet on
That's the
every
Back to the
sporting event,
Future.
so you would be a billionaire. Okay, or you could go 10 years in the future and see what your health is and know like the future,
Jeez, Nils.
right?
Yeah.
And then
the
future
you'd be
you
like,
can
don't
tell you
invest in Tesla or anything.
exactly right. And
Don't
then
buy Facebook
right.
stock.
yes, yeah. Make sure you remember to get Amy her Christmas present in 2027. So the reality of it is I think it depends on what your headspace is. I think for Amy and I think we would go into the future, because that's the way we look. I'm not going to answer for you, but I think we would go into the future. I think someone younger would maybe go into the past, because they're just coming through their life and they're realizing the transitions, and they're like, oh man, I wish I would have done this differently and that differently. I think when you get to middle age, I'm not speaking for Amy, I think you start to accept your faults, you know, and I'm okay with it now. My personality is my personality. My decisions are my decisions. Hopefully you're blessed enough to be in a good relationship and stuff like that. But I think the future is where I would go to. What about you, Amy?
So this was a really tough one for me, because I kind of thought of it this way, like, okay, so if I go back 10 years, like 10 years ago, me is going to be like, oh my gosh, like, you know, they're going to ask me a question that I'm going to have to crush their little eager, beautiful soul by answering truthfully.
Yeah.
So I'm like, wow, can't do that, because I know what I would ask myself. I know what my 10-year ago self would ask myself now, and I know what the answer would be, and it would devastate me.
Mm-hmm.
Like, it would destroy me.
Right.
So I'm like, well, I can't do that. So I can't crush little Amy's soul. So then I'm like, well, if I go 10 years in the future, I'm like, well, okay, well, so then I'd want to ask myself, right? Like, oh my gosh, like, tell me about the last 10 years. And I'm like, shoot.
So this goes to another point. Are you the type of person that wants to know the future or not? My dad died of Parkinson's disease. You can get a genetic test that tells you if you're predisposed to getting Parkinson's disease. Terrible thing to die from. My sister absolutely will not get it. I am going to get it. I haven't had time, but I'm totally would like to know if I have that gene.
Right. Are you the head in the sand or not?
Absolutely not want to know.
Yeah.
Yeah. So for me, I love having knowledge. I mean, that's why I went into medicine, right? Like to be proactive and to do treatments. And it's just really your mindset. So.
Well, that's what's interesting is that you and Nils both brought up like your health in 10 years.
Because
like,
we are men. We have no emotions. Okay. You immediately go to the emotional part. I don't even.
I'm surprised you guys did. I mean, like that is surprising to me. That seems more like something that a woman would be like, oh, am I, like the health component.
Your first thought was like the emotional effect of talking to your previous self or your future self. And I would yell at myself. Like I would be like, listen, jackass, listen, just shut up for a second. I only got a minute here. I'm not even going to be nice to you. It's like, give me all the information I need.
Yeah.
So it is interesting, man. That is kind of a trippy question.
It's a trippy question.
There's no right answer on that.
Well, so what I came to the conclusion of after perseverating on this question for a number of weeks now is that you should always strive to be a person you want to see in 10 years.
Yeah.
And I think that is really where I came to with it, because thinking deeper on it was just, like I said, like destroying my soul. So I'm like, okay, well, so what do I do with this? I'm like, all I can do, because you can't go back and talk to yourself 10 years ago and you can't talk to yourself 10 years from the future, from the past, is make sure that you are spending every day of your 2024 being one step closer to being like, when you see that person in 10 years, just wanting to be like give them a hug and be like, yeah, like you don't even have any questions. You don't need anything because you're good.
Yeah.
So, oh yeah, that was a tough one, right?
I think I'm going to change my answer. I'm going to go back in time. I'm going to become a billionaire. I'm going to freeze myself. Okay. And then I'm going to unfreeze myself when you can do gene therapy. Is that fair?
I mean, that's fair. What was that movie, Cocoon, right? Where they were freezing in the things. I don't know. So, yeah. So,
by the way, in Cocoon, okay, that movie
from the 80s.
From the 80s. Those people, when they shot that movie, were in their 50s.
Yeah, it's like Golden Girls.
Blows my mind.
Wilford Brimley and right,
like, they were in their 50s.
They looked
or a
like
lot of them
75-year-olds.
It's like the Golden Girls. They were literally in a retirement facility, and like one of them was like 39. Yeah. So, thank you everyone so much for listening. Thank you for your voicemails. Thank you for your messages. I am genuinely very, very sorry and super appreciative of everyone who's left me a voicemail, sent me a text, responded to one of our YouTube channels. Everybody's left me a flexi emoji. Love it. There haven't been a ton, but if you know, you know. So flex it out. Please leave me a voicemail.
Yeah, we got a flex for the
New Year flex.
Yeah,
New Year flex.
Yeah.
Oh, you gotta
take your
I
thing
gotta
off?
take my jacket off so you can see my
Oh,
flex.
you gotta pull out your guns.
See my pulleys.
Yeah.
The potatoes are back.
Actually, let's put your pulleys first. There you go.
Side by sides.
Yeah.
So thank you everyone so much for listening. If you have a question, a comment, we love to hear them. And I do love these episodes because they show us what you guys are into. I mean, that really more than anything, like we can pick topics and we get great interactions, but when you guys send us questions, I feel like they're so real. And that's why I love the voicemails, like Mary, Michelle, Amy, thank you all so much.
We are at your service. We are here for you.
Please follow us on social media. You can find all of those social media handles right here. Phone mail one more time. Phone mail. Phone number is 303-630-9038. Words are hard.
Didn't change anything.
No, it did not. So thank you everyone so much. Would you rather listen to us again or watch us on YouTube? You get to decide.
See you later.
Bye.